Good afternoon. I'm Cookeville Mayor Ricky Shelton.
And I'm Putnam County Mayor Randy Porter. This is our COVID-19 coronavirus community update for Thursday, April the 23rd. Today, as of 2 p.m., our total number of confirmed positives in Putnam County is 101, which is one more than yesterday. We also have had 5 deaths, one which is not showing up on the state numbers yet. All 5 deaths were from Signature Healthcare. Please keep those families in your thoughts and prayers. So let's break down our numbers a little bit. In the past 9 days, we have had 9 additional positives, which is very good when you think of our population, especially also when you take into consideration the large number of people we are testing in Putnam County. Our number last Tuesday was at 92, and today we're at 101. Also remember that 51 of those were the Signature Healthcare patients and workers, where everyone in the facility was tested. Size based on population. Just since Monday, we have tested 527 people at our Putnam County Health Department alone. I did some comparison to other counties, and our ratio of tests to total population is comparable to some of the larger counties like Rutherford and Davidson. So the numbers that we are testing based on the total number of our population, when you look at that ratio is up there considerable to where Rutherford and Davidson are. I'm not trying to downplay our numbers. Just want to be as transparent as possible so you understand them. As we continue to do more and more testing, our number of positives are going to go up. But don't panic as you see those numbers slowly increase. The good thing about all the testing we are doing is every positive, when it comes back, those folks are being quarantined and taken out of the general population until they recover. This way, they are not spreading the virus to anyone else. I hope all this makes sense. I just want you to understand our number is going to continue to go up until everyone that wants to be tested is tested. I think that day is coming in the next week to 10 days as you will see testing slow down. The big positive today also is the number of people that have recovered. Out of 101 positives we have in Putnam County, 75 of them have already recovered, which is great. The state average is about 51%. Ours is about 75%, which is much better than the state average. The other counties in the Upper Cumberland that have tested positive are Cannon, 10. Clay County has 5. Cumberland County has 61. DeKalb County has 10. Fentress County has 4. Jackson County has 6. Macon County has 35. Overton County has 7. Smith County has 18. Van Buren has 1. Warren County has 4. And White County has 4. The drive-through testing clinic going on at our health department on County Services Drive off of Willow is still in operation. The schedule this week is Monday through Friday, 9 a.m. to 3 p.m., and they are doing a special testing this Sunday afternoon from noon to 4. If you want to be tested, just drive by. You do not have to get out of your vehicle. They are testing anyone that wants to be tested regardless of where you live or where your county of residence is. Remember, this testing that is being done at the health department is free. Again, Putnam County has 101 confirmed cases, which is one more than yesterday. Mayor Shelton?
Yes, the governor's stay-at-home directive will end April 30th, and State Representative Williams is here with us to go over some of the announcements that the governor made today as far as businesses reopening. We've said all along to please listen, follow the directives, take personal responsibility, heed the guidance from experts, and use common sense so that you can protect yourself, your family, and everyone else. There are no easy, clear-cut answers to this situation. On one hand, there is a virus that not much is really known about. It can and has killed people, spread easily, and you can have it and not know it, or even that you not even have symptoms. And there's no vaccine yet. On the other hand, there's an economic shutdown with issues such as unemployment and closed businesses and depression, poverty, suicide, domestic violence, hunger, and substance abuse. I've heard from many people, frontline medical personnel at CRMC, pastors from local churches, business owners that are still open and some that are closed, employees still working at a location or working from home, and some that are out of work. There are folks that have received financial assistance and some that have applied and that didn't. There are some emphatic on staying closed and some absolute that things must open. My point is, everyone has the right to their opinion and beliefs. I believe the path forward, though, is somewhere in the middle, like driving a car with the foot on the gas and the brake at the same time. It shouldn't be a political decision, it needs to be a people decision. We must manage and mitigate health and safety of our people while we open back up our economy and businesses and get our people back to work safely. Daily, hundreds have continued to shop at Lowe's and Sam's and Walmart. I would say that a small business open with 3 to 7 people in it poses even less of a risk than that. As things begin to open, remember you still have the freedom to choose. You can choose to shop there or not. You can choose to eat there or not. You can choose to attend church there or not. If you don't think it's safe or you don't think the location is being socially responsible, don't go. Or if you want to stay quarantined or avoid crowds, then that is exactly what you should do. Stay home. I think we all realize there will be a new normal. Some of the measures that we've continued to talk about, physical distancing, wearing face coverings or masks or sanitizing, may need to be part of this new normal for some length of time. I would like to speak directly to our local businesses as they start to come online and be open back up next week. It's critical for businesses to let their values guide their action and develop protocols and procedures in advance of re-entering the marketplace to safely reopen while protecting customers and employees. Not all businesses are the same. What works for one may not work for some other companies, and while there is no one thing that makes all the difference, taking a comprehensive, thoughtful approach to safety will lead to better outcomes for all. Things such as healthy habits and being flexible to quickly adapt to new ways of working, as well as a refresher on the basics, including proper hand washing techniques and other hygiene practices. Employees often aren't the only ones in your locations. You may have customers, vendors, or other guests who should take steps to protect others as well. Beyond good hygiene, all of us, employees, customers, and leaders, are encouraged to continue to maintain a 6-foot physical distance from others to reduce the spread of illness. Keeping your team safe and healthy is a critical priority to ensure your business remains open. Without a healthy, trained staff, you'll struggle to meet the needs of your customers. Employees should only be working if they are healthy and symptom-free. Prepare employees for difficult situations. In many ways, the pandemic has brought out the best in people, but the stress and fear can lead some to be confrontational. Prepare your employees to respond to these situations carefully to help ensure their safety. Have de-escalation tips for employees and talking points to use when communicating COVID information to your teams, vendors, and customers. Ensure easy access to information. Employees must be aware of the latest safety protocol in order to follow it. Regular communications and easy-to-access resource documents will help ensure your guidelines are understood and followed. These are some of the steps needed to provide a safe environment for employees and customers. Now let's get an update from Paul Korth, CEO of Cookeville Regional Medical Center.
Thank you, Mayor Shelton. Thank you, Mayor Porter, for allowing me to come today to speak at what's going on at the Cookeville Regional Medical Center. Currently, we have 7 inpatients that are positive with COVID-19. We admitted one more yesterday. There has been a total of 16 patients admitted to the medical center with positive COVID-19. 9 of those patients have been discharged, and as of today, no one that has been discharged or no one has died at the medical center with COVID-19. There still has been no change. We still have 3 employees that have had COVID, but they have all been released because they have been through the quarantine process for more than the 14 days. As our governor is getting ready to implement some reopening of things, the Cookeville Regional Medical Center is no different. We know that the ban for elective surgery and elective procedures will end at April 30th of this year, so we will start gradually reopening the medical center to start doing elective procedures and elective surgeries. Let me reassure you that we will be doing these in a safe manner, not only for the patients, but also for our staff and our physicians. We will still remain social distancing. We still require many things at the medical center, such as no visitors at this time. So there's going to be many things that we're going to have to work out because this is a new normal. And for a patient that comes into the medical center that needs surgery, that individual is going to need somebody to drive them home. So we have to come up with mechanisms to make sure that those family members are notified when the patient is ready to be discharged, notified when the surgery started, notified when the surgery is ending. So we are working on a communication plan to be able to communicate with each and every one of the patients that come into the facility for surgery. We're going to do this in a slow and gradual way. We will start again on May 1st with some general elective procedures. But on Monday, May the 4th, we'll probably add a few more of those. And as each day goes by, we may add a few more. We may have to end up backing up and take a few away. So we've got to be really flexible in this, because we need to determine what's going to happen in our community when we open it back up and we start seeing more people out and about and in our medical center. But let me reassure you, we will be doing it in a safe and effective way. Our emergency room and our clinics remain open. We've had many steps in place. We've processed many steps in place to make sure that we've got a safe environment to treat those individuals. So to make sure that if you're having some medical condition that needs emergent care, feel free to come to our emergency room or any other local hospital emergency room to be taken care of, because sometimes waiting too long is not a good answer. Mm-hmm. Many of our urgent care and many of our physician offices in town are doing telemedicine. We'll continue to do that for quite some time now, so I encourage each of you to get with your provider, and I know many of those have been doing telemedicine, and that is a very effective way to do medical care for many situations. So again, there's been many things happen positively at the medical center over the past couple weeks. We continue to have low number of COVID-19 patients. We're very fortunate that we have had no individual at the medical center to die as of today, and we're very fortunate of that and very pleased with that. And again, we've had many patients that have recovered and are seeing a full recovery of this. So that's the update today. Thank you for allowing me to be here, and we will talk again later. Thank you.
Thank you, Paul. We appreciate you and appreciate everything that's happening at Cookeville Regional Medical Center and all your staff that's on the front line on a day-to-day basis, making sure we're being taken care of here in Putnam County. Next, we have an update from State Representative Mr. Ryan Williams. I think the governor had a conference or a press briefing this afternoon. You have some updates on the openings.
Yes, I do. It was a rather lengthy press conference today. There are a few things I would like to share with those watching online. I do want to take time to say thanks to Mayor Porter, Mayor Shelton, and Paul Korth for their leadership in this challenging time. And so it's very important that we continue to communicate with people about what's going on. There's a few things I want to share with you first. Unemployment, I get many phone calls about unemployment benefits. Unemployment, the governor's added 2 additional call centers, 200 employees, exceeding 350 employees now. To give an idea, there's usually about 10,000 people that are applying for unemployment benefits every month, about 2,500 a week. In the last 5 weeks, we've had over 350,000 Tennesseans apply for unemployment benefits. We got a report today that said that we've paid out more than $12 million in additional unemployment benefits last month over last year. So if you are still having difficulty, we're still working with issues through a system, an online system that has challenges because it's not used to this kind of volume. And so please be patient with us. We're trying to do as much as we can. The governor and staff understand this is a big challenge, and so we're trying to do that. The Department of Education under Commissioner Swin today also released some guidance as it relates to graduating high schools and universities, and particularly the high schools. Having a senior myself, this has been a little bit of a challenging time for the Williams household, but in that guidance that was released today, it's going to give opportunities and ways of which high schools can have either an online graduation ceremony or in some cases with certain parameters met, how they can do one in person. And so it's really important for us to be able to do that and to have this event for these seniors who have been working so diligently literally their whole lives. And so I also want to make an announcement that was determined by the Department of Health and the COVID-19 Unified Group today. Here in Putnam County, we're going to have one of those pop-up testing sites. It's going to be at Sunday, where you currently can get tested at the health department, at the Putnam County Health Department here on County Services Road. But on Sunday from noon till 4, the state, with the assistance of the National Guard and the Department of Health, are going to be doing free pop-up testing here for those 4 hours. So if you want to do that, you just come out in the car, they swab, and then you go from there. And so we'd encourage people, if you want to get tested, this is your opportunity to get tested. As Mayor Porter said, testing is a really important part of what we're doing. It gives us a baseline understanding of what's going on. To give you an idea, though, one of the biggest questions that we have in the state also is, when are we going to have antibody testing? There is antibody testing in certain states across the United States. There are even certain testing that's being done by private companies in the state. The state, however, has not started doing antibody testing. We hope to roll out antibody testing in the next 3 weeks, of which time we'll continue to communicate with you, Mayor, and with the Department of Health would communicate with hospitals and university systems as well as it relates to that. So we want to make sure that everyone knows, if you want to get a test, you can get one. It's free. We encourage you to do that. Next up, Department of Environment Conservation announced that they are opening parks tomorrow. It's very important for you to be able to get outside and eliminate some of that cabin fever, if you will, from your loved ones, whom I'm sure you still love as much as you did before, but this will give you an opportunity to get out. They're encouraging Cummins Falls will be closed, and particularly it would have normally probably been closed because of all the rain anyways, but it is closed because it's too hard to practice social distancing there. But Burgess Falls will be open tomorrow, and there will be some limited access there because there's not a lot of space there, so they will control that. But because of the size of Windy Cliffs, the Windy Cliffs natural area will be open, so you can go there and enjoy that long hike as well if you'd like to do that. So you and your families, we encourage you to take your own lunch, prepare, go to the restroom before you go, stay close to where you are because there may not be restrooms open, there won't be any food there, you'll want to bring your own water, and so we want to make sure that everyone takes care of themselves there as well. We can't, the governor did release today, as you mentioned, Mayor, some guidance as it relates to certain things that are going to be opening sooner rather than later. Parks tomorrow. On Monday, we'll be able to open restaurants at 50% capacity. As you and others know, that our restaurants did practice social distancing using 50% capacity, meaning they could only seat people at certain areas in the restaurant. But on Monday, restaurants will be able to open at 50% capacity. On Wednesday, retail will be able to open in exactly the same way. I know some of our retail places have already done that. The good news is there has been lots of discussion from retailers all across the United States about some best practices as it relates to this and how we can best serve our communities by doing that. There are certain guidelines. The governor announced these guidelines today. He is having a press conference in the morning at 9 o'clock. You can find it online or on your local news outlets. It's going to be much more descriptive about what's going to open over the next several weeks. But those are the things that we haven't heard about, that the mayor and I hear a lot about. Salons, barbershops, elective surgeries. As Paul Kors said, the elective surgeries ends. Dentists, orthopedics, different things like that. There's going to be a big challenge for them to get PPE, so they're going to open as they can in May. But we're going to make sure that those directives have not been clearly laid out. We hope that the governor will lay out those directives tomorrow at 9 o'clock. And so if you have any questions, you're always welcome to call my legislative office or email me. I'm happy to answer any questions that you may have. I do want to take an opportunity to say, yes, we are going to start opening our state and begin this restarting of our economy. It's really important. But things that haven't changed is we still need to practice social distancing. We still need to act around our loved ones and our neighbors as if we have this virus so that we don't continue. Because one of the challenges that we're going to have is a resurgence in the future if we don't continue these practices. So we want to encourage you to do this. It's very difficult. We're in the South and we love each other. And we really want to be who we are. And that sounds great. You can make eye contact and communicate with somebody at a great distance. And so we encourage you to do that. So Mayor Porter, really appreciate the opportunity to be here today to try to help update. I know that was long-winded, but a lot going on in the state.
Absolutely. Thank you for coming today, Ryan, and giving us an update. While we have you today, we always want to talk about our tornado survivors. We continue to remind you about our tornado cleanup. I went and viewed the area today, and it appears we're about 80% complete on the cleanup out in the county, and I think the city may be as close as 90 or 95%. Once TDOT finishes on Highway 70, and they started today working on Highway 70 again, I think that number will go up to about 90 or 95% complete. If you own property in the tornado damage area, We need you to get your debris out to the county right-of-way by the street and the city right-of-way. Most folks have done a great job of that. We have a lot of volunteers that have been working on that, Mayor Shelton, helping people to get that out. If for whatever reason you cannot get your debris moved, please call us at 646-4636. That's 646-INFO, and we'll try to help you. Our volunteer organizations have determined that the last day they're going to be working is going to be on the weekend of May the 2nd, which is a Saturday. That is going to be the deadline or the end of volunteers going out to work. Also, due to all the rain that we've had and is expected over the next several days, the first week of May will be our final pass on picking up the debris. So if you do not have your debris out on the right-of-way by May 4th, it's going to be your responsibility to have your debris hauled away. So we want to try to help you and do as much as we can. We have a private contractor that is doing the cleanup along with TDOT. So if you'll just get your debris out to the right-of-way before May the 4th, we will do our best to get it cleaned up and picked up for you. Also, always want to remind everyone, Mayor, about the Census 2020 form getting turned back in. Putnam County, I noticed our return rates today is much better than the national average or the state average, which just proves how good our citizens are in our community. Right. So remember, you can do it 3 ways. You can mail it in, you can go online to do it, or you can call the phone number of 844-330-2020 and get your census back in. Most of our federal and state funding that we get is based on the census numbers, so we ask everybody to please help us. Mayor?
Yeah, and just to reinforce what Representative Williams said too, you and I are also waiting on what the governor. So we don't have those answers yet, and I know we'll get a lot of messages and questions tonight, and we've gotten those questions, and we too are wanting the answers on what that guidance is. The governor is the one that issued the shutdown orders, so he is the one that has to issue the open up orders, and with that comes the directives. I've gotten a ton of messages from people at salons and barbers and gyms, and so we as soon as we know that information, we will share that. And so we just want you to know that we're not avoiding you. We don't have the answers, and so but we'll post that when we have it, and then we'll make sure that that there's a phone number that you can reach different offices to make sure to answer any further questions. Right?
Absolutely.
All right, so, again, please continue to utilize precautions to protect yourself and others. Be supportive of one another. Wash your hands. Utilize physical distancing when you do go out. Make reasonable, educated, common sense decisions. As businesses open back up next week, we must change some habits so we can stay physically healthy. But remember, if you don't agree with the fact that the governor is going to open those places back up, you certainly have the freedom to stay home and be safe there. So for the most up-to-date COVID-19 information, links, and resources, you can visit bettercookeville.com. And there's a COVID link there. And as we say and would ask, please continue to pray for our country, our healthcare workers, and our small businesses and employees. And let's choose faith over fear. God bless.
And as Mayor Shelton has said, and I'll reiterate, there's probably more questions than there is answers. We got the governor had a press conference this afternoon. You just learned from State Representative Williams about the restaurants and retail. We didn't know about that until just a little while ago. And there's going to be more coming tomorrow. So as we get those orders and those procedures that he's going to put in place of opening, we'll get that to you as soon as possible. And we're also discussing about our city and county offices about when they're going to be opening, and there hasn't been any decision made on those yet, but we will be bringing that to them also.
Yeah, and that's just logistics. It's so we've got to work through those processes, and then what comes after that are ball fields and
sports
complex and teams and so all those things. We're in an environment that no one's ever been in. This is a giant experiment that there's never been a test case of this before. So we're all trying to figure this out as we go, and so please again be patient. And we all want the answers too, and we'll get them to you just as soon as we have them.
Absolutely. And just remember, but as Mayor Shelton said, just because things are going to begin to reopen doesn't mean you need to let your guard down. Everything will not go back to normal overnight, so don't expect that when we start opening up the restaurants and the stuff next week, that doesn't mean it's going to be all back to normal and everybody's going to go back to the way they were before. This is going to be a process that we're going to have to work through. The last thing that we want is for everyone to get out and do too much too fast, and we have another spike in our numbers, and then we're trying to decide what we're going to do
right.
again. We do not want that. We want this to be a steady process that's going to be a safe process, and we're looking to Governor Lee to give us the examples on that. Just remember, Mayor Shelton and I don't have the power to shut down anything. We told you that in the beginning, and along with that, we don't have the power to reopen anything.
No.
So we're looking to Governor Lee for guidance, and hopefully we'll have more on that tomorrow. His reopening plan is going to be for 89 of the 95 counties, and I think there's going to be some special opening plans for some of those bigger cities and counties that will come out.
Yeah, just so people know, the differential for that was that they have those 6 counties that are going to dictate their own. They have county-run as opposed to state-run health departments.
And have the power to make decisions
correct.
that ours
those
do
health
not.
departments have the power to shut down and do that within those jurisdictions, unlike the other 89.
Right. You know, regardless of what the governor's plan is, we have got to keep doing what we can to fight this dreaded disease as we go through this reopening process. All the things we've been doing for the past several weeks need to continue. As we talked about, the social distancing, washing our hands frequently, disinfecting surfaces. The main thing is to make good personal decisions. We can't reiterate enough. If you don't feel comfortable in going to a certain store or going out or
if you're a business,
yeah, and you don't feel comfortable opening.
Just because he says open, if you don't feel comfortable with that, that you have to make that decision for you, your family, and what's best for you and your employees too.
Yeah, you don't need a government mandate to tell you to stay at home if you don't feel comfortable. You need to do what you feel is best for you. Making good judgment decisions is what's best for you and your family.
Correct.
And that may not be what is best for someone else. We'll get through this if we continue to work together. As we say, everyone does their part. But it all comes down to each of us taking personal responsibility and making good decisions. Mayor Shelton and I will continue to do live updates to keep you informed. Our next update will be next Monday, the 27th at 4 p.m. We will not be doing a live update tomorrow.
No.
We will be doing our next one Monday, the 27th at 4 p.m. unless something urgent should come up. And, of course, if there does, we'll come in. We do plan on doing a text post tomorrow, though, once we hear the governor's plans, but just no live update until next Monday. As I say, please continue to keep us as your community leaders in your prayers, along with our cities, county, state, and country. May God bless each and one of you and your families. Thank you.
Thank you.